look, junior doctors, because, you know, in England, they are going to strike again. I mean, they've started it again this morning. It's 5 days. You know the drill by now, don't you? They want a 35%, what they're calling pay restoration. They want to take their pay back, essentially, to 2008. This is their 11th strike, ladies and gents. I mean, I despair, really. We're in the middle of a heat wave. We're in the middle of a general election. Guys at home, do you still support this?
Well, we're talking about waiting lists earlier, and in the middle of an election, the junior doctors go on strike, you know, which is going to cause masses of upset for millions of people who desperately need NHS.
But they'll say they're going on strike because you guys haven't sorted it out with them.
We're spending 180 billion quid on the NHS. You know, I'm proud of the record. That's, up a third in real terms since 2010. We've got it's like 48,000 more doctors, something like 78,000 more nurses in the NHS. Of course, there are problems, but you can't just give one group of people a 35% pay rise. And the problem with the Labour Party is that they say it's a bit like the chap we were talking about earlier, Robert. They say it's a terrible show, but they don't actually say, well, how much they're going to give them. And it'll be very interesting to see what happens. You can't just... I mean, of course, you've got to negotiate them, and we did negotiate with the nurses, and we've solved some of that dispute, but you can't say, well, people can have a 35% pay rise. Who in the country is getting a 35% pay rise? Nobody.
So what would you lot do then?
Well, I regret that the junior doctors are striking, especially during a general election campaign when neither the government or the opposition can negotiate with them. I don't think they needed to do this. We can't afford 35%. That's completely off the Richter scale. Robert says, what would we do? Would we be profligate? You've actually settled with other groups of health workers at 10, 15%, and that's creating the environment within which we're working. But what we do need to do is to get round the table with them. And Wes Streeting has said from day one of a Labour government, he'll be sitting down with them and resolving this strike action. But that won't be 35%. But I tell you this...
What will it be then? What do you think is a fair amount of money?
That's not the way negotiations work. You know it, and I know it.
You must know what you think is a reasonable amount of money.
Well, the government's already accepted 10 to 15% for other health workers. I think it's in that ballpark. But I tell you this, 13 years of a Labour government, we never had any strikes in the National Health Service because we funded it properly, we worked with the staff and we improved the system, and that's what we need to get back to.
Is that fair?
Well, I gave you the figures. We're spending...
Was there any strikes when Labour was in office?
We're spending, NHS spending is up a third in real terms, £180 billion, a huge amount of money. We've got many thousands more doctors and nurses, but we've got problems, legacy from COVID, because of all the people who were sadly denied appointments because of the COVID pandemic, millions of people, and that's why we have millions of people on the waiting list. They are making some progress with that, although there's a long way to go, and there's a lot of work to try and improve that, a lot of money that's being invested. But you can't just, if you say you're going to give doctors 35%, where does that money come from? It comes from the taxpayer, or you spend less elsewhere on the NHS because you've got to give that 35% to the junior doctors.
Can you help me understand something? Maybe I'm just overlooking something really basic. So these guys want pay restoration to 2008, right? But by my calculations, some of these people won't have even been starting as junior doctors in 2008. So they've become subsequently on that pathway, knowing the T's and C's as they were at the time. So how can you take a job knowing the T's and C's at the time and then suddenly go, hang on, despite the fact I've only just joined, I want to look backwards and I want my pay to go back to what it was before I was even there, despite the fact that I accepted it subsequently? What am I missing? Because
that's what trade unions do. And it's an argument. I don't think it's a persuasive argument. 35% is not deliverable. And I will say this, I think the British Medical Association have a track record of, let's just say, not negotiating reasonably on behalf of its members. Nevertheless, we need to get round a table and resolve these strikes because they're damaging and they're putting the service back. But one other thing to you, Robert, you said, it's all about the pandemic. Waiting lists were through the roof before the pandemic. It's because of the way the Tory government has underfunded the health service relatively over 14 years.
£180 billion is not underfunding. Going up a third in real terms is not underfunding.
And you know that the pace of technology and the ageing population means you need to spend more.
Thousands more doctors and nurses is not underfunding. And how much more money would the Labour Party... Are you saying how much more money would the Labour Party spend on the NHS?
over a Parliament, we are determined to invest enough and reform enough to get waiting lists back to 18 weeks.
We've said we'd carry on increasing NHS spending in real terms in the way that we have done. We just announced a few £1 billion for NHS technology in the recent budget. So billions of pounds have been going into the NHS, but they're trying to. There's a lot of reform that needs to come through the system, rather than just saying, "Oh, yes, it's a problem because we haven't got more money."
You need both. You need reform and you need investment, and that's exactly what we had under the last Labour government.
Well, we've had it here. And 180 billion.
But you haven't delivered. 18 weeks maximum waiting time when we left office. 18 months under your watch.
Yeah, but hang on.
You're not, as I say, you're deliberately not including the reasons for this are because of the COVID pandemic.
At the heart of the, or one of the key strands of the Labour Party's plans for the NHS, it's all about leveraging technology. And you say about your great performance in last time he was in office, one of the biggest public sector IT failures that's cost us taxpayers, depending on which estimates you look at, some would say it's £10+ billion, was under a Labour government when it came to them trying to modernise the NHS using technology.
Gordon Brown's PFI deal saddled hospitals.
Do you know what?
Debt.
Governments of all political persuasions have not been great with IT, and we need to get better in that, and we need to get smarter in that. And there've been failures under the Conservatives, and there were failures under the last government.
I'm telling you, both of you gents, nice people, but there'll be so many people watching this wanting to headbutt my desk because they will say that we just need change. We just need something that is change. I'm using your strap lines now. Could be a campaigner for you, couldn't I, using your words?
But do you know what, Michelle? Don't judge politicians by what they say. Judge them by what they do. And the figures
I am. That's why I'm telling you. Yeah. That's why I'm telling the pair of you that you're both abysmal, your parties, when it comes to immigration. I'm telling the pair of you that what you've done to things like the NHS is appalling. I'm telling you that when you talk about IT and improving IT, I'm judging you on your track record, which is you created the worst public sector IT failure that we've had in this country in the NHS.
With respect, you're not judging us on our record, because when we left office, maximum waits were 18 weeks.
You
People
on
could
your
get
deployment
GP.
of technology.
I'm talking about health outcomes and the service, and we had the highest satisfaction levels in history.
Private financial initiative. The PFI, Gordon Brown's been
and we got 100 new hospitals from it.
But hold on, you, because you was, I thought it was your party that introduced PFI, whilst it was your party that massively rolled it out.
No, Robert,
it was Gordon Brown.
You know that's completely untrue. It was John Major who introduced the PFI.
Please, who extended PFI across the hospitals? Gordon Brown.
Yes, this is what I'm saying. It's the pair of you at fault. It's the Labour Party and the Tories. Goodness gracious me, we're going to fight it out.